what I'm going to talk about now, I hope you're not all fatigued on the point, but it is the sort of legacy of COVID-19 in the industry. I don't think anyone would be surprised to hear that the supply chain was put under significant pressure at the peak of the pandemic. Obviously, this could have had a potential impact on employee mental health, particularly driver mental health. And the media has reported increased alcohol consumption. And I think it's safe to say, looking at the arrest figures just for Merseyside as an example and Essex, it could suggest increased drug use. So do we feel this has had a detrimental effect in the workplace? In recent years, there's been a lot of work put into reducing the stigma surrounding mental health. For example, Heads Together, which is run by the Princes. There's been much discussion from high-profile celebrities. There are podcasts out there now with regards to mental health and trying to stay happy. And I think obviously there's much revered sports personalities that are talking about their experiences with mental health. However, I think there are still some horrendous statistics regarding suicides and people keeping it to themselves and maybe self-medicating when they have mental health conditions. Isolation during lockdown, potential bereavements and anxiety about being away from loved ones or potentially losing loved ones could have had an impact on employee mental health. And I wonder, particularly Chris, with regards to maybe your Occy Health background, how are you finding that? Have you seen an impact on employee mental health following lockdown?
We've just been reviewing all the shielders in prep for pause of shielding. And actually, we were expecting an impact on mental health. And the answer is no. We have seen some, but the percentage is so small that you can deal with them individually. What we're now seeing is, strangely, those that stayed in work to produce the food, they're the ones that are coming down with the anxiety. And it's not really clear that this has only come out this week, and I've got loads of phone calls coming through asking, what we can do. So obviously we put therapy in for them. So yeah, it's strange. We didn't get what we expected in terms of the shielders, but we certainly are starting to get it this week with those that have always been in work.
Okay. Do you think that's pressure related with regards to, I suppose, the needs of society during lockdown, in particular in manufacture of food and milk, etc., for yourselves? Do you think that the pressures on the employees and drivers for getting products from A to B, that's why we're seeing this anxiety issue? And I suppose the angle we're coming at it from is, do we think that maybe people might have taken stimulants more or drank more to deal with those pressures?
Yeah, I would have to say I'd agree that a lot of people have self-medicated. Just looking at the figures of how much alcohol has been sold through the period by the supermarkets, that in itself tells its story, doesn't it?
It does. I mean, obviously the drugs are a sort of a hidden quantity for us. All we can go off is arrest figures. Given the reduced road numbers, I think that sort of speaks for itself, as you say. But I wonder whether this will exacerbate drug abuse and whether people are now coming out of lockdown, or rather have worked through lockdown to support the supply chain and may have a bigger drug problem than they had before. So I think one of the stats that Ian had pulled out for me, the European Monitoring Centre for Drink and Drug Abuse, they've reported specifically on this issue. Now we're coming out of COVID, so the implications. They say, just in summary, because it's quite a lengthy report, but they say that those that do take drugs and drink are doing it more so. So what do you think in terms of workplace that we could do as organisations to, I suppose, try and get a handle on that as people are returning to work or as we're coming out of the other side of lockdown? I suppose I could go to Paul on that. Paul Harvey, because you yourself work in health and safety. Is there anything that you think you've stepped up as an organisation in order to try and combat that?
We have really put a lot of effort into firstly keeping in contact with home workers. So we have 4 operational sites which have been operational all the way through. So we're able to support people face to face, but we obviously focus a lot on our home workers. We have quite a large central office that have been at home, so it's making sure we're keeping in contact. And you know, we've found that's put pressure on people on our end, sort of different ways of working. So we're now opening up our head offices. So, you know, we are going to be bringing the people that are home back into the offices, so they'll be driving in, and, you know, so, you know, it's a good thought about what we need to do around, you know, how have they been at home, and we're now bringing them into the workplace and ask them to drive in and get back on the roads and stuff like that. So it's quite a food for thought.
It's been a learning curve for all businesses, and
yeah,
way to go with your support for your employees. Simon, do you mind if I come to you on this, because I know you've developed this Ready for the Road app, which is free for download. How much take up have you had on that, and, you know, do you include sort of fit to drive? I know you've got a declaration on there, have you?
There is a fit to drive declaration on that, yes, and we've had an incredible take up from it. We've had literally hundreds of businesses register for that, who collectively employ somewhere in the region of about 70,000 drivers, I think. And yeah, fit to drive is an element of that. I mean, I think the potential impact here, there's kind of three, and you've touched on a couple of them. And you mentioned essential supply chains early on, which was you know, one of the big ones. But I think it's also linked to fatigue here as much as mental health, because specifically with those, there was they were operating way in excess of their sort of capabilities and initial capacity to start with. Massive recruitment drives going on. Those recruitment drives are largely still going on because they're still short-staffed, and so I think there's a potential risk of drivers in those sectors taking stimulants to keep them going, as Paul mentioned in his original presentation. You know, he mentioned taxi drivers. They obviously do very, very long shifts, and it's kind of, you know, known about that they take stimulants to keep them going. And I think there's a risk of that in these other industries. But from a mental health point of view, obviously, you know, people who've been furloughed have got various anxieties. We know alcohol sales are up, and you know, you mentioned that sort of alcohol use and drug use was up too. So all of these people who've been furloughed at home for the last few months, they're now coming back into the workforce. So have they got used to, you know, that may be that they had occasional use at the weekends, and it maybe wasn't enough to make them question their ability to perform at work, but now they might have got used to taking a great deal more because they didn't have any other obligations. So they're now coming back into the workforce, and when they do come back, has their workplace changed in any way? Because you know, at the extreme, they could have lost colleagues from coronavirus, so their job could have changed, their whole role could have changed, the people they work with could have changed. I think it's starting to become widely accepted now that as the furlough scheme gets unwound, there's going to be quite significant job losses. So, you know, an increase in anxiety about job security is potentially going to cause people to start self-medicating again with drink or drugs. So, I think from an employer's point of view, those are some of the key issues that employers need to be aware of about staff. Because if they're not aware about the drug use, the size of the drug problem as a whole, they're probably not going to be thinking about some of these issues that are directly as a result of the lockdown.
No, I agree. I definitely agree, and I'm glad you brought up those other 2 points. Ian, did you have anything to add on that?
There's a couple of things. One was one of our friends who is unable to join us. She actually put in her question what she would like to understand from today, and she used the use of drugs and alcohol as a crutch, and asked if other companies were seeing it. So it's a pity she's not here to present that question herself, but it's obvious that it is out there, and it's a case of whether other companies are actually recognizing it, possibly.